Hello, I'm Andrea Darr. I'm the pharmacy officer for Avera eCARE. In my role here, I'm responsible for the clinical practice of pharmacy within any of the aspects of eCare services. Avera eCARE is a provider of both telehealth and telemedicine services. It's located in Sioux Falls, South Dakota. It began in 1993 with our eConsult services and has now expanded to include intensive care medicine, emergency services, pharmacy services, geriatric services, behavioral health, and others. Avera's telemedicine services really began as a service within our health system. We found them to be so successful and so needed by those in our communities that we elected to move outside of our health system as well. So I think that's one of the things that we really are proud of, is the idea that we know what it takes to provide these services on the other side as well. So these have been very valuable programs in the development of our services and being attentive to our customers' needs. eCare Pharmacy services began in 2008, and we started providing services just to critical access hospitals in rural areas in the upper Midwest. Many of the facilities did not have adequate pharmacist staff. Those folks usually had just an hour or two of pharmacist coverage during the day. So we were able to provide 24-hour services to that facility, and that was really a boon for them. We have now expanded quite a bit, and we're servicing nearly 100 facilities and have a national goal of expansion. We provide services to critical access hospitals, community hospitals, long-term acute care, and surgical centers. Basically, anyone that has a need for our service, we would consider what we could do to help them. eCare Pharmacy services include remote order review and entry. We do clinical consultations with providers and nursing staff. We're able to do ongoing monitoring of the patients throughout their stay in the hospital. In addition, we can help the nurses with medication prep and administration. We really provide excellence in clinical services. Avera eCARE services are provided out of a central location that we call the eHelm. This is a very open environment that allows collaboration between many of the different service lines. Pharmacists that work in eCare Pharmacy are able to collaborate with a variety of specialists in different areas. So whether it's the intensivists that happen to be working that day, the geriatrics physicians, the critical care nurses, emergency physicians, and beyond, we have resources at our fingertips that we can consult with to help solve patient problems. There's almost nothing that we come up against that someone in this facility doesn't have expertise in. Another advantage of having this collaborative environment is that the other service lines can also come and discuss their questions and concerns or adverse drug reactions with our team of pharmacists. We always have several available, and so it could be that they have a quick question, or it could be that there's a baby that's having problems in an emergency room and they need some specialized dosing of different products than the nurse on the other end is used to preparing and administering. So many times our pharmacists will walk right over there and help both the emergency physician and the nursing staff at the facility to help take care of that child. eCare Pharmacy provides a variety of services to the hospitals that contract with us for service. Order entry and verification is probably the most common reason customers seek us out for service. However, we provide a lot more than just that. Our order entry services also involve the pharmacist fully reviewing the electronic health record for the patient, making sure that each of those therapies are appropriate and safe. If there are any questions or concerns about that, the pharmacist then alerts either the nursing staff or the physician as appropriate. Antimicrobial stewardship programs are now required by both CMS and the Joint Commission. In order to help our customers with achieving those standards, we have provided both guidance in the development of their programs as well as help in evaluating patients on the days that the pharmacist may not be on site. So over the weekends, overnights, all those protocols will be followed and all those adjustments will be made to therapy as necessary. In addition, we can help provide pharmacokinetic dosing for those vanco or aminoglycoside consults that come in from physicians. Patient discharge counseling is a new avenue for us to directly interface with patients before they're discharged from the hospital. This has been a request from some of our customers who really did not have a pharmacist available to meet with that patient to clarify any questions they might have before they go home. So this has been very important in making sure that the patient understands the new medications that they will be taking, understanding which of their medications they were on prior to admission will be continued, and any concerns that there might be about medication storage, side effects, and the like. eCARE Pharmacy provides outpatient services in a number of areas. Probably the most important might be our chemotherapy reviews. Some of our hospitals don't have two pharmacists to provide that important double check. In that case, our pharmacists will double check the original pharmacist's calculations on those important chemotherapy medications. If there's no pharmacist on duty, we also provide two checks. So two of our pharmacists will independently calculate those doses and assure that those medications are what is intended and within a safe dosing range for the patient. As we know, chemotherapy is one of the most toxic types of medication therapy that's available. Another aspect of outpatient care where our pharmacists can have an impact is in infusion therapy. Those medications are often very expensive, and it's very important that they are used to their greatest benefit. Thus, having a pharmacist review for appropriateness before those are given can help both with the safety and also with the appropriate administration of those medications so that that investment is used to its greatest value. eCARE Pharmacy has provided service for emergency departments as well, both freestanding and those that are associated with an inpatient hospital. eCARE pharmacists review non-emergent medications in the emergency areas. This allows for better review of allergies, contraindications, allows for better empiric therapy for infectious disease, and provides review of any drug interactions that may occur. So this, again, provides that extra level of safety when things are crazy. I'm really proud of the pharmacists that we have at eCARE Pharmacy. They come from a variety of backgrounds and experience, but all have training and experience in hospital pharmacy. Some have previously worked in cardiology, pediatrics, informatics, sterile products, surgery. Several of our pharmacists also hold specialty certification in either pharmacotherapy or geriatrics care. We all take our experience and help solve problems for our patients and our customers. So we not only understand the clinical aspects of care, but also the systems involved in hospital practice for pharmacies. So we understand distribution systems, we understand technology. All of those things really come together to help us provide for our customers' needs.
Hi, I'm Todd Falkenstein. I'm the operations officer here at eCARE. I'm responsible for onboarding new customers, the implementation process, vendor management, and strategic business development. There's several types of technology we use here at Avera eCARE. It's quite diverse based on our customer needs. I think the first and base technology that we use is our order management system, which is called Avera Tracks. We use it to collate the work that comes from our customers, be it order entry review requests, medication preparation requests, discharge patient counseling, or home med identification. It's super essential for that order management system to create an efficient workflow for our pharmacists so that we can deliver on customer expectations. We also have a live video technology solution for our customers. To provide live video consultations such as discharge patient counseling, we use an iPad with a pre-configured VPN for secured access directly to our hub. This allows ease of access for our customers to connect with our pharmacists to perform such actions. We also provide an application on the iPad that allows them to take still images and upload directly into our order management system. Those images are never stored on the device itself. In addition to the iPad, we also have a dedicated still image solution for our customers. This can be used for medication preparation in a hood or just in a dedicated area. We can also use it for identifying home medications or reviewing ADM fill lists. This also has a touchpad on it and a foot pedal so that it's easily used for sterile preparation and you don't have to leave your product in order to take photos. Innovation is certainly the key to being a meaningful service provider. As the healthcare landscape changes, so must the services provided to our customers. We have an innovation lifecycle process that we follow for all ideas and suggestions that we get either from customers or internally. That process goes from setting up a business plan to deploying technology and infrastructure to testing, piloting, and then finally implementing with our customers. We do this to ensure success of the program, to make sure that we're cost effective and we're delivering on the key approaches that were either identified by our customers or internally. I'd say in addition to that, being a part of a health system has been really key for us. With 31 hospitals, behavioral health center, heart hospital, they've been integral in developing programs both for our health system, but those programs are also very useful for our customers as we deploy outside.
Hi, my name is Patrick Bruggeman. I'm the National Sales Director here at Avera eCARE. It's my role here at eCARE to identify, educate, and help onboard clients that have a need for our services like ePharmacy. While typically hospitals have a variety of ways that they measure ROI, it seems as though there's a couple of areas that are pretty common with customers. The first is typically looking at what their alternative staffing model might look like. So if they were to staff pharmacists on their own, what level of investment that would require from the hospital's perspective. So typical staffing models indicate that they will need at least 4 or more full-time pharmacists to staff 24 hours a day. And at the average cost of a pharmacist, that investment can be very significant for hospitals, in many cases north of $500,000 a year. The second area hospitals will typically look at is reducing adverse drug events. Pharmacy services are all about making sure patients are safe and that we're administering medications that are appropriate for them. According to AHRQ, adverse drug events can happen as frequently as 4.5% of a hospital's admissions. And when those adverse drug events happen, many times they can be avoided. Other studies suggest that 95% of adverse drug events can be avoided if a pharmacist were to have prospectively reviewed that medication order. We've leveraged other studies that suggest that every adverse drug event that happens in a hospital has a cost associated with it. Our estimates are around $2,500 per adverse drug event. So when we talk to hospitals and prospective customers, we can very quickly, using the alternative staffing model and also the reduction of adverse drug events, talk to them about the return on investment they're going to get by leveraging our services. I think what's important when you start talking about competitive differentiators is not what we think is important, it's really what our customers tell us is incredibly valuable and unique in the market. I think our approach at Avera eCARE in pharmacy is very unique in the market. We spend an inordinate amount of time with our clients up front prior to the date of go live, making sure that we've documented all of their policies, their procedures, their protocols, what's in their formulary, what's non-formulary orders, etc. To ensure that once we do go live, anyone who interacts with our services, whether that be a provider, clinical staff, or even their on-site pharmacist, really views us as an extension of their hospital pharmacy. I believe something else that makes eCARE pharmacy a little bit unique is the environment that our pharmacists work in. They're surrounded by board-certified emergency room physicians, intensive care physicians, geriatricians, and countless clinical staff. So the ability for them to collaborate with other different clinical specialties really helps make their job easier. And conversely, those other clinicians and providers can leverage our pharmacists in order to be able to help solve patient cases in even other service lines. So we really truly have created a virtual hospital here where that collaboration is paramount, just like you would typically see in a brick and mortar hospital today. I think another wonderful differentiator for us, we believe, is truly our pharmacists. So often when talking about telemedicine or telehealth services, we focus too much on the technology. The reality is it's people on the other end delivering this service, and we take great pride in our team of pharmacists. They are incredibly experienced. All of them come with hospital backgrounds, and we, with 30 different pharmacists that we staff across our facilities, we can leverage over 500 years of clinical pharmacy experience. To me, that is something that makes our customers feel confident and also ensures that we're delivering great clinical quality service. Clinical expertise and experience is something that our clients leverage quite often. Many of our hospitals have limited resources at their disposal, and having experienced hospital-trained pharmacists available to them 24 hours a day really can be a benefit. Here's an example. Melissa Dirks, staff pharmacist at Ely Bloomington Community Hospital in Minnesota, said, "Neither pharmacist here comes from a hospital background, so we're very thankful that we can rely on Avera eCARE pharmacy services to help us with dosing questions and monitoring patients." The approach that we take prior to going live with our customers is incredibly critical. We take the time to make sure that we document policies, procedures, protocols, formularies, etc., so that when we do in fact go live with our clients, it's a very seamless transition. Here's an example of a customer who valued that approach. Colin Richards, Clinical Director of Emergency and Inpatient Services at Atchison Hospital in Atchison, Kansas, said, "It has been an easy transition to the Avera eCARE pharmacy services product offered by Avera Health, and I believe this was solely based on their willingness to put in the work up front. This pre-go-live work certainly paid off with what I would say was a very smooth transition for our critical access hospital in rural Kansas. Pharmacy services they provide have proven to be a cost-effective solution in the improvement of patient safety, as well as a satisfier for both our staff and patients. I truly believe that by having a consistent process for the analysis of issues and good two-way communications together tend to head off any negatives, and I'm happy to say that this is what we have and continue to experience with this service each day."